If you're staying late to finish notes, you need to hear this. There's now a free way to get help with your paperwork. ScribeNote is an AI scribe built just for veterinarians and techs, helping you handle documentation so you can spend more time with patients and less time buried in medical records. Their free plan gives you access to core AI-powered scribing features at no cost, unlimited auto-generated notes with ready-made templates for soaps, dental charts, multi-pet visits, callbacks, recaps, and more. You can lightly customize templates, collaborate with your team, and even get help from Otto, their AI chat assistant. Admin overload is real. Over 40% of vets have considered leaving the profession because of it. ScribeNote exists to help you stay in the job you love and actually get home on time. Check out the free plan today at scribenote.com. Hey everyone, welcome to another episode of Reviving Vet Med. Today we're talking about mentorship, professional growth, and support networks, essential ingredients for sustainable, fulfilling veterinary careers and strong, resilient team cultures. My guest today is Alyssa Mages, BS, CVT, and co-founder and chief visionary officer of Empowering Veterinary Teams and director of MentorVet Tech. Alyssa has spent over 20 years in the veterinary profession, blending hands-on clinical practice, leadership, education, and consulting. She's passionate about ensuring every team member has a voice, fostering mentorship and helping practices thrive through tailored training, coaching, and professional development programs. In this episode, Alyssa and I talk about what mentorship really looks like in vet medicine, why it matters for resilience and job satisfaction, how team members and leaders alike can engage in meaningful mentoring relationships, and how creating a culture of support and growth can ultimately revive veterinary medicine. So let's dive into my conversation with Alyssa Mages.
This is the Reviving Vet Med podcast, and I'm your host, Dr. Marie Hollowaychuk. And my mission is to improve the mental health and well-being of veterinary professionals around the world.
Hi, Alyssa. Thanks so much for joining me on the podcast today.
Marie, it's great to be here with you. Thanks for having me.
Yeah, I've been wanting to chat with you for a while, and I'm really glad that we have the chance to talk about this important topic. For listeners who might be new to this space, how do you define mentorship in vet medicine, and why is it so critical for well-being and career development?
Man, I think we could spend like 3 episodes on that question alone. I have a short answer that I'll start with, and then maybe we can expand on it together. So hopefully just get into a little bit more about what you and I both do and why it's different sides of the same coin. So I tend to think of mentorship as a process. And by that, I mean, it tends to be utilized synonymously with training and coaching and teaching. But for me and the work that I do with my org, it is we train the skill, we coach the person, and that process is mentorship. So teaching comes into it, but that's more classroom based, and which is why I kind of chuckle when people say, oh, I work at the teaching hospital. It's a training hospital, but that's okay. We won't split hairs on that. So for me, it is something that is constantly evolving. It is something that is critically necessary for every position, whether you sit at the front desk or are wielding a scalpel. And it's really taking a look at even beyond clinical skills or what you need as professional skills and simply human skills, right? What is your emotional intelligence? How are you really doing self-care? Spoiler alert, it's intentionally doing nothing, right? And taking a look at how that impacts you. So making sure that that journey isn't necessarily the balance between life and work. It is the experience of you finding yourself and how that evolves over time, both as an individual and as an individual in a professional setting.
I love that. Gosh, I love the way that you put that all together, and it makes so much sense. And yes, having worked in academia, we always referred to it as the teaching hospital. But you're right. That was really separate from the classroom teaching, the in-person training, and then all of the coaching as well. And I love that you also brought into that the human skills, right? Those so-called professional skills, soft skills, human factors, whatever we want to call them. Some more derogatory terms than others, but so important to have this holistic approach. And so important to recognize the importance of that when it comes to well-being. And I know we're going to dig into that a little bit later in the conversation. So talk to me about your career, because I know that it spanned clinical practice, education, leadership, consulting. How have your own mentors shaped your path, and what lessons do you carry forward into your work with others today?
It's been a journey, right? I think all of us need to spend more than a hot minute taking a look at from whence we came, right? So it's never been a straight line. It's been a lot of, as my friend Sonia, I think you know Sonia Olson, we loved it, pivotal path, right? You pivot, you hit this, oh, just kidding, come this way. So I've been very fortunate to have some really incredible mentors, and they span the gamut from veterinary technicians and veterinary surgeons, general practice veterinarians, and humans outside of the field, right? Having some incredible people that are some of my closest friends, but also think of it this way and let's, figure out how we can get through this. So it's giving yourself that mirror. And I think that's another part of mentorship is you step back and you're the reflection of who your mentee is finding in themselves. And so they let me take a deeper look into that. And it was really, okay, well, you want to be a veterinarian. Great. Let's help you get there. Okay. Now you're pregnant. Just kidding. So what are you going to do about that? You need to think about it. What are your priorities? And really weighing the pros and cons. And all right, you're moving back to the States and how's that going to look? And this is changing and you're going here and you're doing this. And so really finding those people that aren't just going to give you those pat responses or that, cliched advice. It's someone that's really going to take the time and really invest of themselves in the process with you. And so it's just, like I said, I've been incredibly fortunate and I still have contact with some of them today, that I was an assistant and thought I knew everything. I did not, and we're very kind to be like, sit down, shut up and watch. Right. And it gave me, the wings to grow and fly. And I stand on the shoulders of giants. This has been an evolving profession. This has been an evolving branch within our profession and generally. And so there's just been some incredible, and majority of them have been women, which is really fantastic. But I have great parents too. And my grandparents were really influential. So the list is almost endless. And that, again, is a lot of privilege sitting here saying that. But I've never not had someone that I could go to with a question or a concern or an extra box of tissues when needed.
I love that. The research is so clear that it's so important for us to feel that we have people that we can turn to during times of stress or uncertainty, or even if it's just questioning ourselves, right? And I think that our mentors can have such a buffering capacity in that space, especially when we think about things like imposter syndrome, right? Our mentors know us, they know our aptitude, they know our skills. And so they can, like you said, turn that mirror towards us. I often think of my mentors as well in the past as shining a light on my blind spots, the things that I don't see for myself yet. It's like, you don't know what you don't know. And so being able to point those things out, being able to challenge me. So not just the support, but also the enhancing of self-awareness and gaining those skills, like you talked about emotional intelligence, gaining those skills along the way. And I have to say, having been through an internship, a residency, vet school, obviously, and then being mentored as well as a young faculty member in academia, the biggest things I remember from my mentors were not the technical skills and training and teaching, so to speak, that they did, but the human skills, how I conduct myself, how I speak, my tone of voice, my pace, my nonverbal communication, just the art of teaching and guiding. It's fantastic. And there's so many poignant words of wisdom that I remember along the way and then try to pass down, even ways of being. And I can remember at times mentors saying, when I would say, gosh, thank you so much for XYZ. And they would say, well, my hope is that you will do the same thing when you are mentoring others. And so such powerful relationships. And like you said, lifelong friendships, colleagues, and so on. I'm curious, obviously, the space that you and I work in, very much I consider us both firmly entrenched well-being advocates. We work in a space where we talk a lot about individuals experiencing burnout and job dissatisfaction. And I'm wondering how mentorship, whether giving it or receiving it, can influence well-being and resilience within our profession.
Sorry, these questions are just absolutely incredible. So thank you for putting the thoughtfulness into them. I think it's really burnout has unfortunately become one of those buzzwords, right? My concern is since it has done that its impact and importance may also get lost. I don't think it is because there's so many of us that still recognize that as a legitimate concern, and we're going to continue to do that work. And, to your points of you remember these gems and you hold on to them and pay them forward. Back in my day, I'm in that age where I didn't actually, I'm sure other people did, but I didn't know I was being mentored. I didn't know that was the term. I wasn't aware of it until I started really diving into this deeper in the work that I've done with MentorVet in the past 3 to 4 years, and really shifting my career focus from that clinical realm into the non-clinical, so to speak, right? That was those human skills that I really do love that phrase. So I think because when we're focused on this process, whether as the mentor or the mentee, we step outside of ourselves, right? We step away from the hustle, the bustle, and we really home in on what matters, right? What's at the crux of the issue, what's really getting into it. And if we're in that space of safety, if we have the rights and the privilege to be safe, to be vulnerable, when we can do that, it's magical, right? And if we can provide that space for someone else, what a gift, right? That, I can utilize my lack of melanin for something better. And it's really making sure that we take a look at what's happening there, right? It's a cumulative process. You don't burn out overnight. You can become fatigued and your heart falls off of your sleeve for more than 24 hours, but it's really trying to be aware of it, of ourselves, and then catching, like you mentioned, like the nonverbal cues and really understanding what's not being said. And it's not simply a veterinary problem, right? We are hopefully aware that we live in a really cushy little silo when we think that all of this happens in vet med and no one else understands. I'm not saying that we or anyone else who's listening, but as a general colloquialism, it's a human problem. And when we can really focus on the humanity that we are all experiencing and, get out of our own ways and take that breath collectively, that's when you can step into that place and take that breath together and give that sense of this is going to be okay. It's not right now. And that's also something we have to get comfortable with is, embracing the suck, so to speak. You got to get comfortable with the discomfort. It isn't comfortable. This past year has been rough for a lot of us, most of us, for so many reasons. And so being able to say, I'm not okay. It's definitely something predominantly in the States too, where like, how you doing today? And we don't wait for the answer. We just keep walking. And what if someone says, I'm not great? It's like on the holidays. Everyone was like, how are your holidays? And I was like, they were awful. No one knows how to respond to that initially, right? Like, oh, what happened? Just leave it that they weren't good. How are yours? Right. But having that ability to create that space to step outside of ourselves and really talk and address that this is a problem and we have to say the things out loud before we can start working on the things in the present.
Yeah, I love that. Just validating the experience and normalizing what the person is going through and giving them that safe space to talk about it. And I know, similar to you, and the times in which we grew up in vet medicine and did our training, we weren't talking about this at all. And I know, looking back, that I was experiencing burnout throughout my training, towards the middle to end of my internship, and then again in my residency, in the middle ground of it. And that came out in a lot of different ways. And at the time, while I had incredible mentors, that wasn't part of the conversation. And then fast forward 5 years later, when I'm now in the seat of mentor to my residents and can see their struggle, can see their burnout, that second year slump, we used to call it. It happened to almost everybody where their mental health took such a turn and burnout really set in. And I think we can still do a better job of holding space for individuals in those situations. And thankfully, the conversation around mental health and burnout is changing. So we are able to offer more supports. It's clear, though, from the research that at least, and a lot of this research here in Canada has been done in the large animal space, where, of course, a lot of veterinarians are going out on house calls and doing things where they're alone. And you bring up this concept of togetherness. We're in this together. We're doing this together. We're talking together. We're helping each other. That's one of the biggest predictors of job dissatisfaction, and leaving a career in large animal medicine is not having a mentor, not having someone, even if they're not out on those house calls, maybe, but they're maybe early on, or hopefully early on, they are shadowing them, or they're there by phone if needed, that a person is just not being cast into the trenches without any sense of support or someone to call or someone to lean on, even if it is medical and not those human skills we talked about. But even if it is just, oh my gosh, I've got this really hard calving and I don't know what to do. I don't know what the next step should be. So yeah, I think the more that I see the rise of different mentorship programs and supports in vet medicine, and the more we talk about well-being, the more I see how closely aligned these two are, that you cannot have well-being without mentorship and support. It's just the two really must go together. And it's in every industry. Like you said, I think about my fiance who's found himself in a new role within the last few months and feeling very alone. His supervisor was seconded to a different role, so he didn't have a supervisor. He felt lost. He was really not enjoying some of the work that he was doing. And a lot of it was because he didn't have anybody to go to. He wasn't feeling like he was working with someone or could call someone. And, he works for the city. He's a city employee. So very different than what we do. And yet the importance of mentorship can't be understated. So, Alyssa, you co-founded Empowering Veterinary Teams to provide that tailored training and coaching. How does mentorship fit into your broader vision for supporting veterinary teams?
You can't leave it off the table, right? So we joke, my business partner and I, Caitlin Keats, she's just phenomenal. She's not from vet med. And I would recommend when you start a business, whatever industry you're in, have an external perspective. It is refreshing, infuriating at times, but absolutely necessary. She's an engineer by trade, and she was a program manager in the defense sector. So if you want to talk about organizational skills, that woman is a goddess. So it was really, we wanted to be very intentional about this. And so every couple of years we revisit, we go through the core values exercise, which I love, and take a look at what that's going to stretch out into. And we joked when we developed the training programs and how we go into practices and work with the teams is we're going to be like a tapering pred dose. I know that's not necessarily a thing right now. Internal medicine specialists don't come for me, but everyone understands it who's been in vet med for longer than 10 years. They get it. So we go in, strong and a loading dose, and then we taper ourselves off so that by the time we step away, everything is in place for them to continue to succeed and build upon it and do it more. You can't do that unless there's concepts and ideals of mentorship embedded within, right? So again, that's why I want to go back to what we started the conversation with. Mentorship is the process of training and coaching, right? So you're working on skills while supporting the individual. That is mentorship in a nutshell, right? So if you're developing a training program, if you're looking at growth and development within your practices, mentorship has to be one of the keystones of this, right? It's one of the 3 pillars. It has to be. And so what does that look like, right? What are you looking at from a mentorship perspective? You need to have clinical skills conversations. Yes, mentorship there. But then again, that's the training piece, right? And if you're looking at developing yourself as professionals and as humans that have to interact with each other, 80% of the work we do in vet med is people oriented. You need to work on those skills as well. So it's really making sure that you establish, is this a formal mentorship partnership? Is this informal? What does this look like when you're creating and, selecting your trainers from your team? Make sure they want to do it because otherwise this is going to go nowhere. And understanding that you have to start with the basics. Everyone does. And then you move up from there. So it's really taking a look at, again, the intentionality and that one of our mission statements is we meet you where you are with what you need. And that's the key, right? It's the golden rule redone. It's not treat others the way you want to be treated, though that's nice. Switch it. Treat others the way they want to be treated. Ask. Get curious, right? If you don't get curious and understand what people need, how are you going to help? You're just going to get in the way. And that's a big part of it too, is making sure that you involve people in this, that this is their program, that this is what they want and need. Hands off, eventually.
Mm-hmm. It's so interesting. And what you said right there, I feel like the epitome of mentorship, right, is meeting the person where they're at, right? And so maybe in that moment, they do need training per se. They need correction of a skill, or they need advice about a case, or they need to debrief how they're going to interact with this client, whatever it might be. But not jumping to those conclusions, staying curious, asking questions, because sometimes when people come to us, and that could be a partner, a friend, a colleague, a peer, they start talking and we immediately jump into what we think they need, right? With advice giving or, venting or whatever it might be. And that can totally fall flat when they're like, no, I need you to help me right now. Or no, I don't want your advice. I just want you to listen, or whatever it might be. So I love that you talk about it being so intentional. And I love this concept of meeting people where they're at, because it's not your agenda as a mentor. There is reciprocity here. There's something that mentor and mentee get out of it, but it's very much dictated by the mentee in terms of what they need.
Absolutely. And it's always, again, that word process for sure, because I am not perfect at all. It's fluctuating what my moods might be, especially at home. My poor husband and kids, they're very tolerant and supportive. I say all of this like it's so, roses and rainbows. And there's always rainbows in my office, but it's not easy, right? This is something that, with that intentionality comes a lot of hard work and it's frustration. This is something that is going to push people in ways that they might not like, right? Change is not something that everyone is a fan of. I love it most of the time. And it's something that you do have to, plan for. So contingency plans are key, right? And taking into consideration how people communicate, what is their learning style, pairing people up so they actually can collaborate in an effective manner. There's a lot of pieces that goes into this, but it comes back to exactly what you said, is letting the person that is being mentored steer the ship.
Hey there. Are you feeling stuck, overwhelmed, or just ready for a change in your veterinary career? Coaching with Reviving Veterinary Medicine might be exactly what you need. At Reviving Vet Med, coaching is a transformative partnership that helps you reconnect with your purpose, set meaningful goals, and create a sustainable, fulfilling career in veterinary medicine. You can book a free 20-minute introductory call. No obligation, no pressure, just a chance to see if coaching could be a good fit for you. Visit revivingvetmed.com/coaching to learn more and schedule your free call today. You bring up some great points, and I would love for you to unpack that a little bit, Alyssa. When you talk about the different forms of mentorship, so to speak, or that it can take on many forms, right? There can be formal programs, such as what you've developed and been involved with. There's informal guidance, peer support. What approaches have you found most effective for fostering growth? And maybe that is determined by the situation. But, engagement is something that is so important within the veterinary workspace and intersects also so closely with well-being. Could you unpack these different forms and talk about how they each can be effective in their own way?
Absolutely. And I have to give credit where it's due. The majority of my mentorship, entirety almost. Well, I've apparently been a mentor over the years and didn't even know. But really in the official capacity, where I've learned the most has been from Dr. Eddie Reinhardt and the work that she's done at MentorVet. And so doing all of the associated courses and some certificate programs of my own and a lot of research, and making sure that the program that we developed together for the technicians was not, oh, this is great for veterinarians, cookie cutter, put it over here. It's not. It is definitely Marielle Hendricks, who is now the COO. She is a veterinary technician as well. I'm going to get her acronyms wrong because we can't agree on one in the States, but that's a whole other podcast. is really making sure that it was relevant and appropriate to what we do. So to actually answer your question now, is the formal setting has been fantastic, right? I see a lot of really amazing conversations happen there. The structure helps a lot of us. Any type of neurodivergence, you're going to have to be aware of that too. What structure works, what structure is detrimental. So being very conscious of, when we're doing any type of mindfulness exercises, if this is not working for you, please message me and let me know. And we have alternatives, right? Making sure that we're very aware and inclusive in things that sound can affect people in different ways. And visual stimuli are not the same. So having a monthly meeting and structured learning modules has been beautifully impactful. We've reached a ton of mentees in the past 3 years, which has just been so overwhelmingly beautiful. Like I cry almost at every facilitation session, which is not normal for me, but that's how much it means for me. I've also then landed in places where I have a bit of a more informal structure. So I meet with one of my mentees from the first cohort of MentorVet Tech every quarter, just for an hour to have a virtual coffee, just to catch up and see how she's doing, how I'm doing, and what that looks like. There's no contract, there's no set agenda, things like that. Versus another mentee of mine, we meet once a month and she has assignments that she does and we check in on those. We haven't signed anything. It's been a verbal agreement. That works beautifully. We are peers, right? I'm a little bit more in my leadership, more experience, but she is a technician and she is in practice. And then you have the reverse mentorship, right? There's that concept. And Addie does a much better job of explaining this. She actually does this whole really neat ball of yarn that all combines it together. So if you pull on one thread, you've got somebody, right? So peer mentors, the traditional mentorship of someone more experienced or older, doesn't have to have anything to do with age necessarily. And then you have group mentors, you have virtual, you have one-on-one, you have all of these things. You have outside of your profession, you have mental health providers, right? All of these things to build that network of mentorship. And again, it builds this kind of almost like the spirograph when we were kids. And you create this design so that if you do pull on one of the threads and it's gone, but I have this. So yes, it does depend on the situation. It absolutely depends on the individual. It really matters on what you need. And as the mentor, what's your capacity, right? I've gotten so many requests being as like the director of the program. They're like, we want to work with you. I was like, I would love to work with everybody, but I have to be very mindful of my limitations, right? And be very honest, say, I appreciate this. I'm not the right fit for you right now. And that's really hard for those of us in the well-being space because we're real good talking about it and understanding how important it is and giving these recommendations and learning when we're not listening to win, to your point earlier, right? But we're not always great at doing that for ourselves. And so this past year has really been, for me, that shift of stepping away from organizations and remembering the word that we first learned as toddlers. No. This is the year of my family. My daughter's graduating from high school this year, right? There's a lot of lasts happening this year. And it's a good thing. This is what she's supposed to do. And we've had to say goodbye to a lot of people this year in our family. It was awful. And yet how fortunate am I that I loved so deeply. So it's really taking all of your personal experiences, recognizing where you're coming from as a mentor and as a mentee, because you have to tell your mentors, like, I'm not in a good place to learn from you right now. And then seeing what, depending upon the situation and the individual, is going to be of most benefit for everyone involved.
I love that. I think that's so important because I think if we as mentors or anybody who may be stepping into a mentorship role is not in a space to do that, it could potentially create harm to the relationship and to the mentee because it's a big commitment. It's a state of mind. It's all of these things. It's this awareness, this intention. It is not just giving advice on cases every so often. Like there is a relationship that you're building. And yeah, we need to have the headspace and the energy to be able to put that into play. Otherwise, yeah, it's not going to work. So thank you for sharing that. And I'm glad that you're working on your no usage. Like you said, something that we all struggle with. Alyssa, I think this brings up a good point that is worth discussing, which is when there are challenges in the relationship, and we'll start with challenges with the mentee. So when mentees are struggling with things like confidence or their communication or workplace culture, whatever it is, all of these non-case related things, right? Like the human skills, as we've discussed. How can mentors help? I have a feeling some of the things that you're going to say, but I want to hear from you.
I think, again, it's going to be very situational and individually dependent, right? Because the same recommendations and work that you do with one person will not land well with someone else. And so really spending the first, okay, this is what we need to work on. These are the steps I'm going to take you through to get there, and mapping out that plan. And then really having them, even with you, even just like co-working, where you're simply on a call and they're working on something while you're there, maybe not doing something even related. Say, okay, what have you got? Let's revisit this. Okay, this is what I've been doing. This is what is not working. I think this might work. What do you think? Well, let's walk through that. Let's unpack that, right? So that would work for somebody. And so going back to your point of like, how do you listen to make things work and how do you get to that place, is that's what you ask. It's like, okay, in today's conversation, I need to know, are you looking for advice? Are you looking to get something off your chest and me to just sit here? Are you wanting me to like get on this train with you and we can just, rally together? What do you need from today? Not from me. What do you need from today? Because if you offer yourself, they're just going to take it. So it's setting that boundary very clearly, but also making sure that you ask what they need. And that also establishes that sense of trust. Like, oh, okay. And then mapping out, okay, this is what I'd like to start with. This is where I'd like to see us going. This is what I would do in this situation. I also try to avoid that statement because it's like when one of your clients asks you, well, what would you do if it's your dog? Of course I know what I'm going to do, but that's not my job, especially as a technician, not my job. So I can see this working in one of two ways. And then I would say what I might do and what I might not do. How does that feel for you? Well, I don't know if I can do that. Let's bring it back a bit, right? And you break it down into bite-sized chunks, right? You don't want to attack, how do you eat an elephant? I would never eat an elephant. I'm vegetarian, just throwing that out there piece by piece, right? Okay, how do you eat a whole salad bar? Leaf by leaf. There, that's a better plant-based alternative. So you don't attack it all at once. You have to start somewhere, right? And that's really, but you have to lay that expectation. Wherever you set your expectations, that's where people are going to meet you. So if your bar is real low, that's all you're going to get. If you set it too high, people are going to get frustrated and you're setting people up for failure. Right in the middle. And you don't have to say that. Like, I'm setting my expectations here for today's session. Don't say that. But really, when you're phrasing these things is, okay, this is what I'd like for us to work on together today. This is why. Give them the why. Because how well do we do when we don't know why we're doing something? Right? I can do something really well, technically, right? That's where training comes in. I can train a monkey to do something. Great. Why are we doing this? What is the goal here? And so some people, again, you've got to be aware of different type of learning styles and divergencies here, because SMART goals are very frustrating and don't work for a lot of people. So then you have to have flex goals and you have to look at the GROW model and you have to understand all these different ways to communicate, right? There's the insights training, there's DISC, there's so much out there. What works for you might not work for someone, but try it first and then look into the alternatives. So have a plan, stick to it with flexibility, and make sure that you provide options and always have transparent communication.
I love that. I love that there's this notion of identifying an expectation and tying a why to it. So that if you're talking about communication, for example, why is this so important? What do we hope to achieve? What is the impact that we hope to have? And then moving from there in terms of asking questions and getting curious. I think that that's so, so important. And I had a feeling that that was something that you were going to touch on. I want to talk about a topic that I think is coming up a lot these days in veterinary medicine and especially in the well-being space, and that's psychological safety. In your experience, what role does mentorship play in creating this culture of psychological safety, this comfort in speaking up, asking questions, saying that you made a mistake without fear of repercussion or consequences?
It's your built-in advocate, right? It's someone who has your back. And I think that's what we need. And that's what we're missing, right? It tends to be a very competitive field. And again, this is a generalization. This is not everyone. And there's so many places that are very good at this. And we should have Josh and Phil on here. This is their area of expertise, right? But really making sure that you are that person, right? When you are mentoring someone, you are that safe space, and you are, wherever you show up, establishing that by proxy, right? So having someone that is with you on this journey. So like, okay, I can do this because I know Alyssa's in my corner. Even if I'm not physically there, simply knowing that you've got someone on your side might give you that chutzpah to do what you need to get done. And it's, they've done research in this in human healthcare too. If you don't admit mistakes, the healthcare actually declines, right? And deaths increase. But people that admit that they've made a mistake and they focus on that and they talk about it in rounds and things, it improves. Interesting. We also have to have that sense of accountability and that sense of trust. And that is sometimes even scarier, right? Particularly between departments and or roles within a practice, right? Are you comfortable calling out one of the veterinarians on a miscalculated dose as a technician? Maybe not, but if it's your patient's life on the line, you better bet your butt you should be, right? Because 6 mils of Metacam is a lot different than 0.6, especially in a feline patient. So that's where I tend to start. Right, is we are really good at advocating for our patients and for potentially our coworkers, our colleagues, our teammates, not so good at doing it for ourselves. So that's where the mentorship piece comes in, right? There's a sense of advocacy, there's a sense of camaraderie, there's a sense of accountability, all of these things, right? Because we have to have that space to learn, to grow. And there's too numerous to count quotes about what happens from failure versus success. So I think it's an all-encompassing ideal, right? Of making sure that you have the knowledge of what these concepts are to create that space within yourself to provide that for somebody else.
Yeah. So there's this idea that if you have this mentor that has created this safe space for you, built on trust and support and advocacy, et cetera, that you will feel more apt to speak up and say something. And I think that goes back to what we were sharing before, which is that confidence and that everything else that we had said. What advice would you give to team members who want to become mentors but aren't in formal leadership roles at this time?
That they're probably leading and they just don't know it, right? You don't have to have the title. I remember working with, she was one of the more experienced technicians on the mid shift, which was honestly, when I worked in the ER, my favorite. 2 to 2 was great because you could have your day. And I was not allowed on overnights after a month. I was too bubbly. So it was a good place to land. She was not the loudest, nor was she the most, I don't want to say well-known because she was. She rubbed some people the wrong way. But she was, man, we'd have emergencies flying in. There'd be surgeries having to start. We'd be doing codes on the treatment tables. And she would just, all right, let's do this. We're going to focus here. I've got this. Les, you go take care of that. The duck metaphor, right? Like she's paddling furiously, but none of us saw it. And so when she was doing that, like it set the tone for the whole shift. She had CVT after her name. She wasn't a VTF. She wasn't a manager. She became shift supervisor. Thank goodness, right? So it is a decision that you make, right? To show up and to speak out and to lead by example is the best thing I can think of. And I know that is, again, a phrase that's thrown up and bantered about too often, but it's so true, right? I think, is it Elvis Presley? A little less talk, a little more action, please. Right? So all of those things, when you get into a position of leadership, and hopefully you're not just, oh, congrats, you've worked here for 10 years, you're a manager. Right? When you get into that position and you have the support and the willingness from, management or whomever throughout the administration, academia, or what have you, to teach you how to do this, right? To go take some courses on leadership and management. When you are finding yourself in that role, now comes the responsibility to set the tone officially. But you've already done it by exemplifying it simply by being who you are. So do what you're good at. Learn what you're not so good at, demonstrate that you want to learn and grow, and show up.
Awesome. Great words of wisdom. What about for our practice owners and managers who are listening or watching? What are 1 or 2 practical steps that they can take to build a mentorship program within their hospitals or maybe to consider some of the mentorship programs that are out there if they're looking to improve retention, job satisfaction, and team performance?
That's a great question. And it's fairly loaded, but I think all of these have been in the best way. Again, it is going to be location specific and practice specific for sure. But the easiest first step is talk to your team, and not simply a survey. And hopefully they're used to being, that does help, and it's verifiable data for sure. So have that after you meet with people, which is maybe part of the concern is how often are you talking with your teams? If it's the dreaded annual review and you don't have conversations, this is going to be more of a challenge, right? So start normalizing, hey, come and chat with me in the office. Keep your office door open unless you're on a phone call. Get out on the floor when and if you can, when it's appropriate, right? Have conversations when people are restocking, just like a conversation we're having, Marie. Talk with your people. Observe what's happening. Understand when when you go into the treatment room and it feels like you could cut the tension with a knife. Don't have the conversation then, but look and see, why is it so tense, right? Are people actually having lunch breaks? Are they going to the bathroom? It's really these little things, and no pizza parties, we know they don't cure things, especially for people that have dietary restrictions. Read the room, right? So take a look around and see, what is your workflow looking like? Who's doing what, when, where, why, and how? What are your pain points from your perspective? And then find out from your team what those are. And then really look into the programs that would be beneficial. Can you do it on your own? Absolutely. Should you? Maybe not, right? And there are options to get that external perspective, right? It's like going back to dental radiography. If you don't take that x-ray, you're going to miss the third root. You need that perspective. You need that deeper dive. And so if that's with us at MentorVet or MentorVet Tech, if that's with ReadyVet Go, if that's with some of the other options that are out there that are not coming to my mind, you're all amazing, right? What is going to be a good fit for you, right? Is one-on-one what you need? Is it group? Is it, hey, let's take this, certificate program on developing a mentorship program? Great. The first step is that you're noticing and that you care enough to recognize that this is necessary. That's huge. Talk to your teams, really understand what's going on. And that's a word we use far too often without actually knowing what it means: shared lived experience. So if you haven't gone through what your team's going through, please don't say you understand. You got to really dive into it a little bit. And then do your research about who's going to be, what's going to be the most beneficial for the most people at your practice.
I love that. Again, such great advice and so intentional. And yeah, it goes back again to asking the question, which is so important. Alyssa, this has been such a great conversation, and I want to thank you for your time and expertise and sharing and your humor. I think you're the funniest guest I've had on the podcast to date. So thank you for that. Well, I know, no dismissing any of my previous guests. I want to ask you just one more question that I ask all of our guests when they come on the podcast. And that is, what does the phrase reviving veterinary medicine mean to you?
And this is a time in the collective world's conscious where we don't seem to have a lot of that. Mm-hmm. But it's there. We lose that, then the powers that are trying to be have won. So I love this profession. I am, a little bit physically removed from it in the clinical aspect these days, but my whole team is credentialed, save two. So they keep me relevant and they keep me invested, and I keep me invested. And it's conversations like these and the work that you do and so many in this space. Hope, revitalization, reviving. That's hope.
Well, thank you so much, Alyssa. And I appreciate everything that you do for our profession, and especially supporting our technicians, technologists, and nurses. So yeah, big kudos to you. And thank you again for your time.
Thank you. This has been a delight. And I hope there's more conversations off camera.
Absolutely. So that's it for this episode of Reviving Vet Med. I hope you found Alyssa's insights as inspiring and helpful as I did. I encourage you to explore Alyssa's work with empowering veterinary teams and MentorVet Tech, which we will link to in the show notes. Consider how you might step into mentorship, seek guidance, or create opportunities for growth in your own team. it could have a profound impact on careers, well-being, and patient care. If you haven't already, please subscribe to our podcast so that you don't miss future episodes, and follow us on Instagram at RevivingVetMed for more posts. You can also visit revivingvetmed.com for free resources, blogs, and evidence-informed tools to support veterinary teams and well-being. A heartfelt thank you to Alyssa Mages for sharing her knowledge and passion, and to Podcast Prime Solutions for producing this episode. And lastly, to you, the listener, for being part of this community. Until next time, take care of yourself. Bye for now.